When we're talking about plasticity response or functional responses in the area of brain and in the local region, suppose this is a left-sided mass, I mentioned that there are neural responses in compensation or plasticity responses on the right side. And I want to bring to discussion here some work from a colleague of ours, Feroz Darapur, who's a brilliant researcher here at UCSF, who studied this. So in patients with gliomas, changes in the hemisphere of language function can be seen and can be measured. So again, we know that most people, whether you're left-handed or right-handed, have language predominantly on the left side of your brain, the left frontal, temporal, parietal regions. This group has analyzed patients with gliomas within the left side of the brain and monitored over time what happens to their left-sided function by looking at serial imaging, looking at these neural oscillations, the amount of firing in the brain on both left and right side over time. So to do that, they did whole brain, they measured whole brain activity using, again, speech production, just as a great example. And you could see that the hemisphere of language dominance for most people's on the left side, as you would imagine. But when you measure the amount of people that have a shift in what areas of the brain fire for later on throughout their diagnosis, it increasingly shifts to the right side. So you can see, again, people with left-sided language dominance, the left side of the brain activates when they start to speak. Roughly 29% of these folks had changes so that the right side of the brain began to activate. And these changes from left to right occurred again in roughly a third of people, which is a really interesting finding and a big change in the way we think about how the brain functions and reorganizes. So there's even this hemisphere plasticity response where you can have a left hemisphere dominance to a right hemisphere dominance because of your brain tumor and the treatments related to your brain tumor. Now we're in the lookout for what can promote that change from left to right and the ways that we can stimulate and encourage that to happen. But that was a really important finding to know that, again, left hemisphere dominant patients can have a switch to the right side throughout the course of their disease. And organically, it's happening in roughly 30% of people, which is a very important consideration, both clinically as we treat patients and with respect to how we think about these treatments moving forward. There's a really important concept that has to be brought home as we think about neuroplasticity. And again, if we're taking a step back, the neuroplasticity idea is based on the concept that brain function can reorganize or change in the setting of a chronic problem, like a disease or a glioma or any sort of new environment. This must be weighed against the fact that we know that a certain population of brain tumor cells actually interact with neurons in the brain. And these glioma to neuron interactions are physiologically important and meaningful for the patient and the disease. So we know from the collective body of work from several researchers show that interactions between, this is again a neuron, for example here, and glioma cells drive tumor growth, and feeding back, glioma cells secrete proteins that makes neurons fire more, that results in seizures and other things. So these neuron to glioma and glioma to neuron interactions through both secreted molecules as well as direct connections or synapses is an important part of the physiology of how brain tumors grow. And it's really critical that we think about some of these potential therapies with respect to this.